Umitri rangba kejela konrat ke sangma hanya kesibaar ula Plie pajba ya ke North East Summit ke Lumpung ke banya mirjumut ha ke banya kon pynduh jait ya ke jingpang TV hapo kejela bat kari India berokawai ke belebu thong dengan sarkar pedeng menpin urlong hapo usnyam hajar arpusan ya kini ke Lumpung ya mirjumut lapan long ha Courtyard Marriott Hotel belawan banya shimbita di kiriu shimpang ki doktor kejela kentubruk kibriu na ke World Health Organization hapo ke jingalam jong Dr. Roderico H. Offrin ubadi UWR WHO India. Abakran ha kejingalang umitri rangba ula ong makakam sumar sukher kedega kam bahkmat jong ke sarkar jella haba pintibru bakini ki khiniat snem balalen ke sarkar kala bon kam ban kinshow pisabha haki kam bayadei bat kakot kakhia bat kala shimru e ki butri kam baper ban pintikna ha ban pinjana ya kakam sumar sukher hamikhalia kibiadon lang ha kini kejingalang ki kintup ya menteri kakot kakhia akong amperin lingdo Dr. Rajendra P. Joshi, DGB, TB Government of India, Director Negrims, Dr. Nalin Mehta, Secretary Katanat Kakot Kakhia na Nagaland bat Manipur, kinong mikmat na kijela kathan chitay lamingi bat kihe officer Katanat Kakot Kakhia kajela. Hagani kasingi umitri rangba kajela ula palat baru ya ka Core Meghalaya Mobile Portable AI-based X-ray diagnostic.
We have continuously engaged and continuously invested in the health sector on various fronts. And today we have one of the highest budgets in terms of percentage, in terms of the entire country, different states if you compare. Meghalaya has one of the highest, if not number one, number two in terms of the percentage that we spend out of our budget on health. Was that we often mistake or we often don't realize what really the problem is. And that happens in governance as a whole, but I think health it is even more. A simple example of that would be, we often say that Meghalaya's problem is the MMR rate, the maternal mortality rate. And we don't fail to realize, and we have different programs and we try to do different things, and we don't realize that the MMR is actually the result of the problems. It's not the problem in itself. And sometimes in governance, as officers, as politicians, we need to realize that we need to be able to identify what leads to the problem. And in our endeavor to be able to provide better service, better policy making, better administration, unless we are not able to put the finger on the actual cause of the problem, we will not be able to find the right solution, the right policy, or the right steps to move forward.